Hi, everyone. Welcome to a very special edition of Collateral Nation. We have my co host, Kevin Morgan, who's here, who wrote quite a few books you can find on Amazon on training for PAD and getting over that crippling pain of PAD and growing your own natural bypasses, your collateral vessels through walking as medicine, as well as some incredible exercises that we're going to be talking about that you don't even have to get out of bed to do to start your day improving your circulation. But today we have a very special guest. We have Doctor of Physiology. We have Dr. Chris Seenan from Glasgow, our incredible world-renowned Walking as Therapy Research of the Year for 2024 and 25. Thank you so much. We're so excited that you're here with us today to kick off our 30-day to a 5K challenge.
Great to be here. Thanks. Nice to see you all.
It's been a while since we've seen you, Dr. Seenan. You are at a brand new university. Do you want to tell us a little bit about that and what you're working on right now?
Yes, absolutely. So, yeah, I have recently moved to the University of Stirling, which is just up the road from Glasgow, so not very far. But I moved over there to set up a new uh, program in physiotherapy, so teaching more physiotherapists and continuing on my research. So it's yeah, great. It's really exciting new opportunities and new people to work with.
Yeah. And I love that you're not just staying in one place, because it's one thing, you really did a great job raising awareness and inspiring so many next generation doctors of physiotherapy with your passion for PAD and all the research. And now you're bringing it to a whole new level, bringing it to another university and saying, hey guys, come on, we got to do something here. So what exactly, do you have any special projects that you're thinking about or getting ready to do?
Um, too many really. That's the problem. I have too many ideas of all these things I'd like to do, and there's not enough time in the day to do them all.
Right.
One of the things I would like to do though is the University of Stirling has a beautiful campus. So it's kind of it has a loch in the middle of the campus and a hill and deer running through the middle of it and things like that. And so one thing I would really like to do is to get a P.A.D walking group set up at the university where people can come and maybe walk around the loch, talk to each other, and kind of provide some support to each other. So that's one of the things I hope to get the students involved with.
It's interesting that, because I'd love to work that out with you, because I think that there needs to be a formula for walking with other people with PAD. I was just talking to Dr. David Dexter from Centara Health over on the East Coast, multiple large tertiary centers across the Eastern Seaboard. And we were talking about how do we set up walking groups throughout, the states. And one of the issues that someone had brought up long ago is that it's not as much value for patients with PAD to walk with one another, because every single one of them is at a different level. And if you're BFFing, do you like the little trendy word slang? BFFing with, let's say Kevin and I are walking together, and I'm at a certain level and he's at a certain level, and I'm like, shoot, I need to rest. I've pushed through as far as I can. The other person could probably go, let's say, another 10, 15, 20 feet before they stop, but they stop because I stop. Are they getting the maximum benefit of that walking session as the person that stops sooner? Or does it even matter? It's
Mm.
it's just
It's
something that someone had brought up that would be worth considering. Like, how do you incorporate or make sure that everyone's getting the maximum benefit? And it may not even matter in certain sessions like that.
Yeah, it's a really good question. I think that would be one of the things I would be interested in looking at and investigating.
Mhm.
In my mind, I think there's a couple of things here. One might be that, yeah, so it might be interesting to think about the type of exercise we do. So it might be something more like kind of short, quick bursts of walking that we do in, like a shuttle walk, or some people call it like Japanese walking idea. And then actually, and the benefit of being together isn't necessarily walking together, but it's the coffee, the tea or coffee afterwards, the chat, the kind of making connection. So the
Yeah.
whole point is perhaps people might walk individually, but chat together. And so it's not necessarily the walking together that's the benefit, it's the other part.
It's maybe seeing other people
Yeah.
doing it and even being inspiring. Like if Kevin was there, and it's one thing, you have some that may get intimidated by someone like Kevin, which we deal with a lot in the group. They're like, oh my God, how am I'm not going to run triathlons. I can barely get out of bed. But it's really that inspiration, that we can turn it into inspiration and say, hey, don't compare yourselves. Use it as inspiration that look at here's what this individual can do, and you can do it too. You may not get to triathlon world triathlete level, but you can at least live your life and do what you want to do without the debilitating pain.
Absolutely. Yeah.
I have a suggestion.
Yeah.
When I went to triathlon training camps, I haven't in a few years, with Chris Hout's group, he would first get our lactate threshold level, and then he would send us off in small groups of people with the same lactate threshold, which would determine how far or fast or what a pace you could hold. I went to one camp in Tucson. He put me with two young women. I was in my 60s. They were in their late 20s, I think. And we were exactly matched for lactate threshold. And so if we can find a measure within a group of similarity of some kind, I made a video on this where I compared P.A.D. claudication level with the lactate threshold. That video, no one looks at it because I guess they see lactate threshold and they don't want to know about it. But we just need to find an equivalent
Yeah.
where they could go on a treadmill with a certain incline, see how far they can go. You end up with a number, and then the people with a similar number go together. This would take a little bit of thinking, but we need to bring, there's two things here. The social aspect, as Chris said, is essential. It's really important, but also walking for quite a while with a person at a similar level where you don't have to stop. This is the problem
Yeah.
with walking. Using your app with the dogs, I tried it. It's impossible. The dogs stop to sniff every 20 feet. And
Yeah.
so you have to keep stopping. You end up with data that makes no sense. And so if we could come up with an equivalent, which I attempted to describe on that video on YouTube, where the words lactate threshold in there, I guess, frighten people off. But I show a lactate threshold graph. I explain how it's done, and it worked brilliantly. I mean, I went on with those two women, young women, similar, much younger than me. We went on a 100-mile ride together, and the group all met up about 50 miles out in Arizona. And then we had to meet in a parking lot with our coach, Chris. There were about 20, 25 of us in the group. And I came up to him and asked, where are we going now? And he pointed up the top of Mount Lemon to the snow line. He, as usual, didn't say a word. He just pointed. So now we had a like 6,000-foot climb on our bikes. And then we had to come back down from the thing. And those two girls based on lactate threshold were the same as me. Nobody was slowing anybody down. Everything was comfortable. When you do those kind of distances, you talk, which takes your mind off of things. They were stronger on the hill climb than me. We all met up at the snow line, and we came back down, which was terrifying, I guess is a word for it. Anyway, so if we can come up with an equivalent where we say, okay, you get on a treadmill, you have a 5% grade, how long can you go? And then you end up with people who say, well, I can do a 3% for an hour and a 5% for, a minute. Then you can get some kind of a measure. Then we could try and put similarly matched together. That's my suggestion.
Well, the 6-minute walking test, I think is definitely something. I mean, whether or not that we would do them, each day when you come in, what's your 6-minute walking test? Just go ahead, do your 6 minutes and get your time and pair up with other people that have about the same time. And if they're a little off, right, that's not a big deal.
Yeah, we're not going to be identical, but that's a place to start and see if it works, and then fine tune it.
Yeah.
You already,
Yeah,
you already have the tool made, so.
I would love to see how to make that work. But then also you can maybe use our app with the people using our app, and then you can measure them afterwards and go, okay, really, you were stopping at a level 5 and you were walking with this person. We're going to switch that up and have you do, something different the next time,
Yeah,
kind of stuff. That would be
yeah.
kind of cool.
And even in doing something like that, a measure would be great to show change over time as well. Because if you
Yeah.
then repeated that a few weeks later or every week, you can actually see if that time is changing at all.
Just the same as
Yeah.
a lactate threshold. As my training progressed, my threshold moved to the right, which meant that I could go longer and longer and harder without completely depleting liver glycogen levels. So yeah, you need a measure, and people need that for encouragement anyway. So in a way, you're talking about creating some kind of PAD coaching program, official or unofficial. It'll take a while, but yeah, no, I like that idea.
But making it more fun, more real. I love that you're doing it out, on the cement out there, here, with other people and making it a community, making it fun. I think that that could be a game changer versus in a clinical setting. I think that you could be creating something that it could be more applicable in their lives.
Well, what would be really good is if Chris could fly you and I over to Scotland and we could have a 1 week vacation, go
Yes,
look for Nessie, drink a few beers, and
That
get
sounds
to know
play
each
a
perfect.
little
other.
golf.
Yeah.
I want to play a little golf over there.
Yep.
Oh, a good walk ruined. Is that what you're talking about?
Yeah. That's the one.
It's so true. Anyway, I just love that idea because then we can figure out and we could create, maybe the goal is to create a program that could be rolled out anywhere.
Yeah.
And it could be almost adopted, by different people that want to run it. Of course, they have to, have the disclaimers, right, for the liability and things like that. But maybe there's a way that it could be applied, like they do, 5Ks just around the area. Why couldn't you have something like that just for PAD patients to come and do that? That would be really cool. And, why not bring in people that are maybe athletes and pair them with a PAD patient?
Yeah.
University students that want to pair, that are athletes that might want to volunteer their time to pair themselves and inspire them and walk with them.
Yeah. Be brilliant, wouldn't it?
I
By
love
the
this.
way, hi, Julia, Mike.
Yeah, Julie and Mike are here. Michelle's here as well. If you guys have any questions for Dr. Seenan, let us know. Just go ahead, let us know who you are. And Patty's here as well. Love Patty. He's over in your region. But one of the questions that came in, which, when I was trying to babble, I was trying to get around to my caboose, to my train of thought there. But the point I was trying to get to was, we did have a question come in, and it comes in all the time, treadmill versus walking outside. And they always notice that they can walk further on their treadmill than they can outside. Like, why don't I actually see the difference? And it's interesting because every single supervised exercise therapy program is, except there are a couple remote that are not on treadmills, but they're on treadmills in a clinic, and they see a great improvement. But is that improvement translating into their life? I don't know. Because patients are reporting to us that what they're doing on the treadmill, they can't do when they're walking and every day on the pavement.
Yeah. Well, I mean, I can start off with that. I mean, I think that there's initially you can see that there is a difference in the mechanics of walking on a treadmill compared to walking anywhere else outside. Because if you imagine you have that belt that's moving underneath you, so all your the work that your muscles of your legs are doing are just almost keeping up with that movement that's going on underneath. So they don't need to quite work so hard in pushing the body's mass forwards, kind of against gravity or up. And so I think that to me is would be an explanation of why perhaps you can walk further on a treadmill than you can, outside. going to the kind of secondary question of, well, is it worthwhile doing it then? Or, you know, do the benefits translate? They absolutely do, because even though the mechanics are slightly different, or it's slightly easier perhaps to walk on a treadmill compared to walking outside, number one, there are things you can do on the treadmill to make it harder, like add an incline or things like that, which changes the mechanics of the walking again. But also just the walking is good, you know, so you are still using your muscles, maybe not quite in as much as you would be if you were walking outside, but you're still having benefits. And that's how all these studies on the supervised programs where they use treadmills have shown the benefit and this building of the collaterals and things like that. I don't know, Kevin, if you might have a better physiological explanation than I've done just now, or some other insight in relation to that.
What you said is correct in that the treadmill does a lot of the work for you by throwing your legs back. So it's very different in that way. But I think the biggest difference is the padding of a treadmill. There's less impact stress. An impact stress sends a pressure wave diametrically opposite to the systolic pressure wave. And I found the lower the impact I can generate as I walk or run, the further I can go without claudicating. If I use a run where I land on my heels, which I never do now, then I rapidly claudicate. And so there's a couple of things. Number one, you need to get through your warm-up before you can assess it, because it's like those collaterals need to be opened up. And then you need to compare the two. And I know I can go for an hour, no problem, on a treadmill. I get out on the street, and within 200 yards, I'm starting to struggle if I run. And I think this is 90% due to impact stress. So learning low impact movement is really important. And that basically comes, and I had to do that myself because I had 2 knee surgeries due to running impact, damaging my meniscus and causing plica inflammation and stuff like that. Literally 2 surgeries, which are self-induced. And so then I went off and studied Danny Dreyer stuff, which is really good. And I went through all the exercises in Heggie's book on running with the whole body. So mastering, there's more to this than just walking or running. It's a matter of mastering body movement, minimizing impact, and also cross-training. So if you know how to walking or running using strong shoulder hip counter rotation, you engage the spring effect, like the mechanism in a watch, of your spine. So that takes load off. Anything you can do to take load off your legs and reduce the amount of blood you need to your feet. And if you combine that with the P.A.D. 100 technique, and all that stuff, that also contributes. So I think the biggest difference with a treadmill is impact stress. You might want to measure it. Maybe we can come up with some kind of a simple device you hold on the hips that measures that impact and find ways to minimize it. Such a device would be extremely useful for mastering low impact walking. That's what I think is going on.
What do you think, Dr. Seenan?
Yeah, makes total sense. And that's really interesting. And I mean, I think it's so much more useful coming from you, Kevin, who can explain it because you've experienced it, and you can kind of exactly, as you say, you've tried all these different things and you understand the mechanisms of what's going on. But that makes absolute sense. Yeah. So it's about kind of, again, it's relation to that mechanics, but it's the impact that's important, the kind of like how your feet hit the ground. Is that what that's what you're thinking?
You must never heel strike. And in order to get around heel striking, which destroys so many people's knees, this is why the shoe industry has these horrible shoes with a big padded heel. You still get an impact, even though you've got those padded heels, and that fools you into thinking that you move incorrectly. I've known a lot of cyclists who can't run anymore because of bone on bone in their knees. And it was all because they ran with impact, running the Boston Marathon, landing on their heels, and now they can't even ride a bike. Several friends I know have had knee replacements because of that. And I had 2 knee surgeries in my 50s trying to, train for Ironman. And fortunately, I'm just lucky. I'm lucky I got medical training. And I think about how to solve a problem, which you do in pathology. I'm a pathologist, so it's all about solving or understanding a condition. And I had some really great help from coaches and body movement experts. And that really helped a lot. I mean, when I thought I totally mastered avoiding heel strike, I was at a training camp out somewhere, California, I think. And Chris Howe goes, Kevin, you're still heel striking. I couldn't hear it. He could. And so I got rid of it. And then, after changing the way I moved after the second knee surgery, and it was funny, really. I was at the track running with a bunch of friends. About 10 of us would meet there, and there were some great runners down there, actually, coached by coaches for UNC cross country and track. And I started doing this low impact run, and you can test it by running over a sand pit. You can see if you land on your heel. If you have a sand pit at a track, a school track or a university track, if you smooth out the sand and then you run a couple of times around the track and then run without changing your stride across that sand, which has to be slightly damp. If you're landing on your heel, you sit. You need to have a completely flat print. If you have a divot at the front, you're straining your Achilles tendons. You're going to have trouble with this. So that sandpit test, of which I wrote a blog post and I have pictures of it somewhere. Maybe I should talk about that again somewhere on P.A.D. If you get that right, you can then really, 2 years after that, my friends were all laughing at me. They laughed on the other side of their face when I qualified for Boston. And so, no, you can actually, you want to try qualifying for Boston. It's harder than any marathon, any Ironman. I can honestly swear the qualifier race for Boston kicked my ass more than a full Ironman race. It's just you're holding this pace for 26 miles. I mean, it's really, really hard to do. And that was only 2 years after my second knee surgery from running induced damage. So yeah, the way you move is essential. And there are a lot of really good body movement teachers out there. And the biggest problem with that? They're not covered by insurance.
And that brings up a really good point as well. There are organizations out there that just say moving is enough. And so they're playing to the least, person that just doesn't want to move at all. So at least move. But in my experience, moving does not make a difference for patients with P.A.D. It's not about just moving, it's about how you move. And that'll lead me into a question that's coming from, Cheryl, because she's been walking and walking and walking, and she's been doing this for many, many years. And yet now suddenly her leg has started to bother her and she's got P.A.D, but she's like, I don't understand. I've been walking for 10 million years. I used to walk 20 miles a day, and now I'm down to 5 in just the last 3 years. I also now have problems with my SI joint deterioration. So it's gotten harder and harder to do any sort of inclines, steps load bearing because of the severe pain, and crash afterwards. So she just doesn't know what to do now because the SI joint deterioration, flaring with activity. And she says, and I mean any activity now, but needing to walk for P.A.D, I'm in a little bit of a pickle. She wants some tips, tricks. Yeah, she wants some tips.
Okay, my first symptoms of P.A.D came when I was running marathons and doing full Ironman races. I mean, an Ironman race is a 2.4 mile swim, a 112-mile bike ride, often through the mountains, and a full marathon. So clearly, movement wasn't enough to keep my P.A.D at bay. It has to be the kind of movement and how it's done. So you have to become a P.A.D endurance athlete, and we're still developing methods to do that. When it comes to the SI joint pain, that's a tricky one. You might want to check with a PD, what do they call those guys? Osteopathic doctor, who put mine back twice because it got out of line due to, I fell over a couple of times, once on the bike and once while moving a shed in the garden. That's one thing to do. Another thing is a soft weight belt that you can wear. Well, also it's a potential thing. So I wonder what Chris has to say about that, as he's a real doctor, and we shoot our patients if they break their legs.
Yeah.
Kevin.
Well, that's the old story about vets. Yeah. Vets and the horse.
But you're also a PhD in pathology and FRC path. So,
No,
you have a little bit of credibility.
I wouldn't shoot the horses. That's just why people joke about vets. You see these cartoons of a guy's falling off a ladder. He's at the bottom of the ladder. He's obviously broken his leg, and the vet has a big gun behind his back. It's just a standard veterinary joke. But Yeah, no, we're in the very early days of working out how to deal with this.
Yeah.
If it can be solved by medicine and surgery, great, but it's not going to happen in the next 20 minutes. So this kind of the other thing is exercise is so critical as you age. I mean, the difference between me and my peers is I'm 82 years old and people say I look 60. I mean, I know I'm I'm a young guy in an old body. I know that, and I still have to deal with the problems, but exercise is so important. And if you exercise early in life, then you actually have the collaterals ready to use. I'm pretty sure of that. Anyway, Chris, over to you.
Yeah,
Yeah,
I
I
think there are
mean,
two different issues. Yeah.
yeah, I mean, I think you've made some good points there, Kevin. And I think the key thing for me and about the relation to this question, Kim, is that walking and exercise is important, but it's just one thing amongst the many things that you need to do almost to kind of that can affect the progression or the disease process. So if you think that the the risk factors, as we call them, for peripheral arterial disease include things like as Kevin says, age, family history, things you can't change, and which would be these non-modified. So naturally, P.A.D will get worse as you get older, regardless of anything else you do. But then there's other things. There's your things like blood pressure, your blood sugars, your whether you smoke, your type of diet you take. All of these things contribute, and they all contribute a kind of a small amount. Um, or they all contribute varying amounts, and it also depends on your own genetics as well. So what we're learning more and more so is that some people are just predisposed to developing the condition, and no matter what you do during your life, it might happen to you regardless. So I think for the person, sorry, I've forgotten the person. Is it Cheryl, did you say, who was asking the
Yeah.
question? Yeah.
So she was one on the just is moving enough, and it just doesn't seem to be the case. It's how you move. But then number two, and then also, as you said, the additional, whether it's medications, smoking cessation, diet, whatever it might be, really all needs to be considered, mitigating all the risk factors. But then the issue, we hear this all the time, there are a lot of people as we age that have deterioration in their back, they have sciatica. Um, what do they do? How can they walk? We have one person that I didn't even get to her, but she was saying that she is in so much back pain, she's in a wheelchair sometimes. So how do you get through and stall progression of P.A.D if you can barely even get up?
I know, and to be honest, I don't really have a very good answer to that.
Yeah.
And yeah, because I think, and this is what many of the people that we've been talking to in through our research projects are the same, because we were all right. Let's do another exercise intervention. They say, great, I would love to do that, but I can't because of this and this other condition I have, or I've got such severe COPD that I struggle even getting up out of a chair and moving. And so yeah, there are Kevin's exercises, the kind of things that you've been discussing, and options to do. There are different things you can do, and the thing is, I guess, to find something that works for you as an individual within your capabilities, but also try to kind of see if you can address the other things that are preventing you from exercising.
I think
Should we?
it's a matter of us choosing between focusing our efforts on cure versus prophylaxis, and I think we need to do both. We have patients who are very far gone, having a real struggle. We want to help them. We do everything we can. We have people who are maybe in their 50s, 60s, overweight, haven't exercised, a little bit worried about their health. And if they are diabetic or have dyslipidemias, then they need to be instructed. It's not too late to grow collaterals and stuff like that. And then people back in their 20s and 30s and 40s need to understand that old age is coming. And if they have any suggestion of dyslipidemia in the family or a potential for diabetes, those people need to be training now. They need to be exercising now. They need to be growing collaterals now. So it's a matter of focusing the audience. The person in a wheelchair needs our help, and we do everything we can. But also the person with incipient P.A.D. in their 40s, also needs to be listening. The real problem is how to reach them, because usually they end up at the doctor when they're already sick and it's getting kind of late. And so I don't know how you get people to enjoy exercise. I always have, or how to, I mean, I've drunk too much in my life, but I never smoked. And now I don't, I hardly drink at all because old bodies don't handle alcohol, that's for sure. But it's, yeah, it seems like we need to almost have different programs for different people, because if there's somebody in a wheelchair and then there's somebody who's 40 who's a runner and suddenly have sore calves, we're dealing with such a different clinical situation. How do we do it in a way that the person in their 40s isn't there wasting their time listening to the person in the wheelchair who's needing the attention right now and the focus on them? I see that as a real challenge. What do you say, Chris?
Yeah, absolutely. And I think that is exactly what we're running up against. There's definitely not a one size fits all in all of this. I mean, again, as we talked about when we were mentioning kind of having to measure people's distances and to ensure that, because so people can't necessarily do the same thing as each other and they won't enjoy the same things as each other. I remember previous conversation within this group as well. Some people saying, well, I love weightlifting and going to the gym, and that was the thing for them, and they had no interest in walking. And other people saying that, well, I really just want to swim, I hate walking or cycling, and I think that's it. It's about finding whatever that person's preference is and trying to optimize how that preference can kind of best affect their disease.
And the key is that no matter what they're doing, I always tell people, you can do the swimming, you can do all of that, but your whole key is you need to trigger the claudication. You need to be able to push through the claudication to improve your walking distance, because you wouldn't care about your PAD if it wasn't affecting your everyday life in walking. So if you're exercise on the bike, if you're swimming, if whatever else you're doing, playing pickleball, if doing just those is not improving your ability to go shopping, to pick up your kids or grandkids, or to do your job, or to just walk from the bed to the bathroom, then you do need to make a change, and you do need to suck it up, and you need to do a regimented walking program, because that's still the gold standard. But I'm curious, Dr. Seenan, Kevin brings up a really good point on the different presentations of disease, and we're seeing more and more of this over the years. It's no longer, P.A.D. is no longer the traditional textbook of smoking. You end up in hitting in early stages where you cramp and relieved at rest, in a general session, right? You have then the diabetics and the chronic kidney disease patients who are presenting at later stages. And many of them haven't been walking as medicine. You have two very different classes of people here. And I'm wondering if that might be, and I'm not even sure what that would look like, to be able to create a research program that, focuses on above knee disease versus below knee disease, and the ability to improve their claudication with walking.
Yeah, good point. That would be really interesting. It's not something I'd necessarily thought about before. And I think, yes, or at least it's something that we don't think we really know very much about in the evidence about how different types of exercise affect different presentations of the disease and kind of where it's affecting people. And I guess, but the other thing I guess I'm also keen to be aware of is kind of understand the person as a whole, because there's the presentation of the disease and which vessels are affected and how old they are, etc., etc. But every individual is different as well. You can have, as Kevin says, here is an 80-year-old probably doing more exercise and than would be someone in their 40s, the same. So it would hate to kind of box Kevin and say, well, no, you can only do this, or this is what's appropriate for you at your age or stage. So I think, yes, it is that kind of individualized approach. But what would be really interesting, as you say, is seeing, well, yeah, what is the best prescription or dosage or kind of approach for different types of presentation of the disease.
And so what do you think? So we have the different exercises that people can do in bed that Kevin is talking about, has been talking about. Would love to hear your thoughts. I know that they have some clinical evidence in a sense, not necessarily for PAD in particular, but I've seen evidence in other things that these exercises can improve circulation. So in our 30-day to a 5K, we're focusing, and I'll have Kevin describe each one. And then if you wouldn't mind commenting on maybe the mechanism or maybe some other ideas along with those, but the yoga toes and the P.A.D 100. And then the third part of it is his way to apply it, those techniques that you use in the P.A.D 100 yoga toes while walking. So Kevin, do you want to just quickly go through the yoga toes, P.A.D 100, and describe them, and then the application to when walking?
Yeah, sure. I notice that people get confused and don't quite understand what I'm describing quite often. I put out a recent video, the latest video in the P.A.D. I think it's just now in the P.A.D. Playlist. It's the latest video where I once again tried to explain exactly what you're doing with your feet, and you're trying to turn them into pumps. Now, a pump, if you think about a pump, let's say it's full of water, and then you put pressure on the cylinder or whatever, and it pumps the water out. But then it has to come back and create negative pressure to pull more water in. There's positive pressure putting the water in, but there's also negative pressure pulling the water back in the pump. And then the cylinder is moved again by turning a handle or running a motor, and it pumps the water out again. This is what you're trying to do with your feet. So the way you can pump the blood out of your feet is by contracting the muscles in your feet to completely flex your foot. So you tighten the foot, but this isn't done in a hard way, it's done in a gentle way. That's why I put that Medusa in the movie, because it exactly describes the way it feels when I do it. But I'm contracting those muscles, which drives blood out of the muscles into the veins. Also flexing my toes contracts muscles in my calf, gastrocnemius, soleus, whatever. And that drives blood out of the muscles into veins, which have valves that prevent backflow. And that's the bottom line of this, there's no backflow. Remember, your body consists of literally millions of pumps. It's not just your heart and a bunch of blood vessels that don't do anything. They do a lot. Anyway, so then you've got the blood out by flexing your foot. And then as you lift your foot off the ground, the trick is to spread your toes. And by spreading your toes, as you can see with my hand, I'm intending to pull the metacarpals in this case, and in your foot, it's your metatarsals apart. And there are vessels that run down between these bones. So what you're doing is you're creating space for new blood to come in, just like a pump when it pulls the new water in or the new air in or whatever it is you're pumping. And so the trick is to get that pumping action going and think like a pump. But you're trying to do this with your feet while you're trying to do low impact running. You don't want to get out of breath. You don't want to go too fast, too slow, too high a cadence, too low a cadence. And you're trying to minimize impact on your heels, all these things. So if you start by learning to do, I now do that automatically. I mean, I look down at my feet walking in the pool, and there they were doing it. It's like riding my bike on a 100-mile ride. I'm not thinking about it. You have to make it a conditioned reflex, but you have to make the conditioned reflex correct. If it's incorrect, it's still a conditioned reflex. You'll be doing it wrong. So the bottom line is to understand how you can turn your feet into remote blood pumping stations, which is basically what I've been doing and struggling with for the last 3 years. And I tell you, it really helps. And then a friend of mine with Parkinson's says it helps her balance when she gets out of bed. Remember, the bottom of your feet have somewhere between 10 and 15,000 receptors for shear, pressure, whatever, that play a huge role in balance. And so she finds it helps her. Another person with a stroke is trying it and found some benefit. So it's not just for P.A.D., but what we've done is we've stuffed our feet in shoes and forgotten them. I mean, if we trained our feet like we do our hands, you could play the piano with your toes. I mean, I think that is really true. But we stuffed them in shoes and forgot them. And there's a lot more they can do. And so it's basically understanding the pumping action of your feet, which is critical. After that, you can think about low impact movement, shoulder hip counter rotation, general training. The fitter you are, the easier it will be to take load off your feet.
Right. But the basics is to get to that point is to start with the yoga toes, right? And the yoga toes
is
you either can do
your
it,
toes.
spread your toes.
Most people have feet like this, all pushed together. And if you have tube socks, that encourages that. And a small toe box in your shoe encourages that. And what you want is you want to get those toes spreading apart so you can spread them without the yoga toes. But first, you got to get them there, and the yoga toes allow you to get there. Because what happens is if the feet are like this all the time, then the connective tissue, the muscles, collagen, elastin, whatever, they form into that shape. I mean, because they're sculpted by your movement. Connective tissue, especially collagen and elastin, and also fat in between these structures, especially in your heel, they're sculpted by shear and compression forces. And so the cross links between elastin, collagen, molecules, whatever, or the location of fat, they shift with the load placed upon them, because that's how your body works. It is constantly changing in response to internal and external pressures. And what you want to do is use that wonderful fact to sculpt your feet into active remote blood pumping stations, and it can be done.
Okay,
And
so I want to get to the
start with the yoga
specifics.
toes to spread. I agree.
Yes. So start with the yoga toes, and that you can get those little squishy things you get, like we get a pedicure is what he means. So you spread like this, and then you kind of squeeze them together, right? Do you also kind of go down like this
Yeah,
as well?
that's shown pretty well on my videos that I made with Rebecca Amos Lawson of moving your feet around with the yoga toes. You never walk with the yoga toes on. You don't want to walk with something that spreads your feet, spreads your toes, because if you walk with it, then they can't come together to pump the blood out. So that's the last thing you want to do. People, I mean, I get asked that question all the time. So you don't want to be spreading your toes all the time, because when they come on the ground, you want to contract those muscles, which will bring your feet together, whether you like it or not, and that pumps the blood out. So that's an
So
important
Julie
fact.
wants to know how long you're supposed to wear the yoga toes. Then I'll get Chris's thoughts just on that. But how long are you supposed to, do you think, to wear the yoga toes to get the benefits?
Okay, you don't wear the yoga toes any more than you walk along carrying weights from the gym. They're a tool that you use to encourage the connective tissue in your feet to let go and let your feet spread. It's a tool. You don't wear them exactly. You use them much like you use a dumbbell in the gym. And so, and then when you get used to lifting up a dumbbell in the gym, it's easier to pick up a pot full of water. That's the deal. So you're not wearing them, you're using them as a tool. And the sole purpose of yoga toes is to get that connective tissue to let go so you can spread your feet. And then you practice spreading your feet without the yoga toes. And that slowly progresses until you find, your feet become more relaxed and flexible. That's step one. And then you start flexing your toes, which contracts muscles in your calves, and you start picking up towels. That's the next step, which of course is headed all in the same direction, is to wake up your feet. And so you do that, that contracts muscles in your calves, which improves venous return. That's a fact.
And then it's the flex and point. It's the P.A.D 100 flex.
Well, you don't point exactly. You flex and you spread. You flex and you spread. If you point, it pulls your toes together. You want to flex your, eventually you can get, so you flex your whole foot and then you lift it off the ground and you spread your toes. And it's all done it's very gentle. Everything's very gentle, but it's basically, you're turning it into this pump. And if you watch an efficient pump working, it's not tense. It's amazingly mechanical. Doesn't matter. And if you watch that Medusa in our latest video, which you helped me find on, what's that, Canva, it's exactly how I think about how I use my feet, because bodies are wet and dynamic and they move smoothly. If you watch a brilliant athlete, everything looks so fluid and easy. And that's what you're trying to achieve with your feet.
Okay.
My
So
dog's
Dr.
scratching.
Seenan, after all of that, what are your thoughts on the idea? Because that's a little bit of, actually a lot of what we're trying to do for the 30-day to a 5K is to get everyone to do those types of exercises daily, to help strengthen their feet, get them to turn their feet into remote pumping stations, and so they can walk more effectively. So I don't know your thoughts.
Yeah, and I think it's fantastic. And I think one of the most important things that Kevin said there was the, I can't remember the word you used, but the kind of conditioned response. So it's to kind of make this unconscious. But to do that, it's that repetition that you need. So that's what this 30, what you're proposing for this 30 days, and what I'm practicing these movements. So the more you do this, the more you do the spreading and the flexing, the more it will just become natural that you do that kind of on every step or as you're walking. And I've just been doing it as you've been talking there. I've been doing it myself. I'm standing here, and I've just been doing it. And you can tell it works so well because my feet are nice and toasty and warm now. They were a wee bit cool before as I was just standing still. But the minute I've just been doing the kind of spreading and kind of as if I'm grabbing that towel, like scrunching up that towel underneath my toes, I can feel the bottom of my calves and into my feet are kind of all warming up, which indicates, as you say, that that pump is working to bring that blood down into the feet.
Yeah, I use that now. I'll actually sit there doing my work, and I do it all day. I now do it on the planes, but I can feel it up in here. I can feel it in the calf, as you said. And
Yeah.
it literally, if I do it for too long, I can certainly feel the burn
Yeah.
after a while.
And interestingly, as I'm doing it, I'm noticing that I can do it really well. I feel I can do it quite easily on my right leg, but on my
Yeah.
left leg, I struggle with the coordination, and I think that's that bit of kind of I'm right-footed or right-sided, and I would tend to prefer, I feel more flexible and more able to kind of control dexterity on my right-hand side. But even just with that 5 minutes of doing it, I could feel my left side getting better and better at doing the movements and being a bit more coordinated and controlled. So, and I think that's that bit about the way I can see this working is multiple. So there is initially the pumping and the moving of the blood, but there's also the kind of conditioning of these muscles that we, as Kevin says, we just tend not to use anymore, or not because they're so big. We put them in shoes and don't encourage them to work. But as you practice using them, and as with anything, if you use it, it gets more efficient. And it gets more efficient in terms of the neural connection. So, for, the signals that come from the brain down to the muscles to make them contract, but also the amount of energy they use up when they're contracting because they get kind of fitter almost. And so if your muscles are working more efficiently, requiring less nutrients and oxygen to contract, then you're less likely to build up the lactic acid and the conditions that would cause that claudication pain. So I can see how these exercise will have that direct impact on perhaps how far you'll be able to walk.
I wish there was a way. I mean, I think you have the app, or you downloaded the app.
Yeah.
If you have ideas on how to incorporate this into the app and what that would look like, that would be amazing, because I think that would help us, especially even this month in measuring, and my development team can do things very, very quickly. But, maybe there's a reminder, maybe there's a page on there that sends a notification that says, hey, do your, these 3 exercises or something, once a day or however many times a day. But would love any sort of thought on how to do that, because right now we're doing it manually. So I'm sending out an email each day to everybody with his videos to do it, but there's no way to really say, okay, did you do that today?
Yeah. There's an interesting in this, I don't know, yeah, it is appropriate. The thing I relate it to is we have in the UK, there is an app that people use for doing pelvic floor exercises. So especially useful for so women get encouraged to use this app for kind of if they've had a baby and delivered a child. So what this app does is it sends reminders, as you're suggesting, to do the kind of pelvic floor exercise to practice them. And what they actually have is they have kind of visual prompt on the screen, because it's about kind of like holding a contraction for a certain amount of seconds and then relaxing and going again. I wonder if there's something along those lines that we could integrate into the app, that would help. So it's the reminder, but then also kind of a prompt of kind of like how to, as you say, Kevin, you know, that even that picture of the jellyfish or something like that, that someone could move along to kind of help them do the movements.
That pelvic
Oh
floor
yeah,
idea is
creating a rhythm.
it's a really good one. Reduces the risk of prolapse and all sorts of problems. And that's why core exercises are another key component of this whole thing. So yeah, I can see how that could be done. It's just a reminder. We need reminders all the time. I mean, it's just the way it is. So yeah. Yeah, I didn't know about that pelvic floor app. I think that's a great idea.
And I know you've answered this, but we have a couple more questions coming in. We have Allie, and I know we cover this all the time, but it's always worth repeating. I think everyone's, questions are always important. If I'm walking and my legs start hurting, am I supposed to stop or push through?
Push through.
It depends.
Ah.
It depends. It depends if you're doing intensity or endurance. If you're doing intensity, you might push through to a point, but you don't want to push through to the point of dysfunction. If your feet start slapping the ground, and then you're doing more harm than good. So you don't push through. You push to the point of dysfunction. And the more you focus on that, the sooner you'll detect it. And then you'll know to stop and get blood into your calf. But if you're trying to force your feet and all those complex muscles in and around your feet to keep walking when they're not functioning properly, you're more likely to cause bruising, especially on the balls of your feet. So the answer is you push forward to the point of any sign of dysfunction, then you have to back off. And back off may mean going slower, or it may mean stopping and refilling, especially your calves. So basically it depends. And it also depends whether you're doing
I think you're
intensity
saying
or
the same thing,
endurance.
though. I think it's still a little bit of the same thing. You just don't want to push through to dysfunction where you think it has to be still tolerable. It has to be right to a point. You just don't want to get to where we always say you don't want to get to a point where you're going to slow down. You want it to maintain the same pace. And if you can't maintain the same pace, just go ahead and stop, let it refill and then go again. But you need to push through somewhat. Right. And I think that's what you're both are saying is just at least there's so many there. We had a patient, Dawn, who said, when I asked my doctor what to do when I was walking, hey, what do I do when there's pain? He said, just stop. And she's like, okay. Now she says that she has lost her leg. I wish my doctor would have told me to push through because I could have pushed through at least somewhat. I could have tolerated, but I thought I was going to hurt myself if I actually pushed through any of the pain. So
if you really push, you're going to have pain. Pain is all part of the deal. It's all part of training. And that's really important. And if they understand that you can push, you can have excruciating pain and still have no loss of function. And that is really an important thing. If you want to walk 10 miles with excruciating pain, you have to be pretty damn tough. But if it's really excruciating and you notice your feet slapping and things aren't working, then you're not doing any good. And that's the art of knowing the difference between good pain and bad pain. And I'll tell you, one of the demographics we have to reach are doctors. I despair of them sometimes. I really do, of their ignorance of this whole business of body movement. It's horrifying.
And I think that's what I would say. That's what I would really, if anything gets through, that's the key thing, is that I think this worry, or no, the key thing is that it's safe to walk into pain to a certain degree. And so don't stop at the point of pain, push a little bit into it as far as you can go. Yeah.
Agreed.
And Mike, you have a question here? Mike is one of those, he started doing the P.A.D 100 and he's now, because he did the P.A.D 100 for quite a bit of time, he's now getting ready. He signed up not for the 5K. He's not, that's below him. He's doing a 13K at the end of the month. I'm not kidding. This is someone that wasn't wanting to get out of bed 3 months ago. Right, Mike?
yeah, literally. Oh, sorry about the background noises. I've got a little question now at the moment. The last couple of days, I've not getting any pain at all when I'm walking, but from yesterday when I was doing the treadmill and today I've just come for me walk out to the supermarket, me Wednesday walk to the supermarket while we're doing this chat. Every, say, 200, 300 yards, my left leg around the knee area is just getting like an ache that lasts for maybe 10 seconds at a time. It just feels like my leg's just going to buckle underneath me. It's not it's not claudication pain, because I know what that feels like in the calf. And it's not so much worrying me, it's just something new that I just wanted to maybe mention and see if anybody could give me any advice on that.
It could be overtraining. If I overtrain on the bike, I'll have that feeling like my leg is going to let me drop on the ground. And sometimes if we overtrain, we can have that issue. Often it's either hamstrings or quads that will give you knee pain. It's not actually in your knee at all. So you could be overtraining a bit. So sometimes the best workout is no workout. What do you say, Chris?
Yeah, it's quite hard to say, Mike, without having a proper look, I guess, or kind of knowing exactly where it is you're feeling it. But yeah, I think just go with as Kevin says, likely hamstrings, quads are the kind of things that might be something kind of to do with either in and around your patella if it is around your knee. But it might be worth just getting someone to have a look at it.
Yeah, it's just above my knee, that's all. It just feels like a little bit of a muscle ache. It just feels like my knee's just going to jolt from underneath me a little bit. It only started yesterday, but I think I did quite a lot of training yesterday. I'm currently learning to do a very high impact line dance. So I've done quite a lot over the last 48 hours. So I'm thinking it might be that. I just wanted to mention it, that's all. So,
are you stretching after your workouts, Mike?
I do a lot of stretching on when I do me high impact on the treadmill, because I do me high inclines and me fast paced walk and jogging on a Monday, Wednesday, and a Friday. So I tend to do my stretches then. On a Tuesday and Thursday, I just do a walk on the flat.
Yeah, I stretch after pretty well every workout. But if you have muscles that are tightening up, they may send you that message. Hey, whoa, back off. And that's because they're actually too contracted. So that's another variable to consider.
Yeah, there's so many variables, when it comes to exercise. And that's why we get so many questions, all the time. It's really great to have you, Dr. Seenan, as well as, Kevin here. And I do have, if you have just a second for another question, there's two questions that are just quickly coming in. One is just about how do you, when you have P.A.D. and you're getting older and you have to walk, but you're worried about, developing osteoarthritis in your knee or in your hip. And, is there a way that you can kind of balance making sure you're not overdoing it and subjecting yourself to other aging issues that are going to basically turn everything, back? Because if you end up having to have hip surgery, well, then you can't walk, for a long period of time, and your pad will progress. So how do you manage all of these things when it comes to aging and trying to improve your P.A.D?
It's a tricky one. I think first thing I would say is we are, as far as I'm aware, or as far as I understand, we're starting to understand a bit more about how osteoarthritis develops, and this idea of it being kind of wear and tear within the joints and that being the thing that contributes and causes the condition is less of a thing anymore. I think that the current kind of guidance or understanding is that exercising is positive and beneficial, because there isn't a type of exercise or a nature of an exercise that kind of causes the osteoarthritis to develop. It's an inflammatory condition you're kind of predisposed to it, and so that's my general understanding of it. I think there is, as Kevin was saying earlier, it's perhaps thinking about the type of, or the kind of the impact and the forces going through the joints is maybe what you consider about and how you would do exercise. So I don't know, Kevin, you want to expand on that a wee bit more, or what would your kind of summary of how do you kind of decrease the impact going through the joints to help people do it for longer?
I think it's really important to understand how your body works and be aware of what you're doing. That's step number one. Number two, you have to optimize the way you move. And you can get a lot of information from taking a group yoga class or whatever. And that will really help. And then when it comes to exercise itself, the key is little and often. I mean, that's really important. And then you need, after you've worked out, you need to listen to your body 2 days later. Maybe the next morning you're stiff and sore, but 2 days later, if you listen and you're
Second
still
day.
sore, then you're overdoing it. I mean, you need to back off. So body awareness, little and often. And also, you know, you may need assistance from a physician who knows if you have severe inflammation somewhere in one of these joints. More things than exercise can cause it. Some people suggest anti-inflammatory diets and stuff like that, and I think they can do some good. Turmeric is a great thing for that kind of stuff. So I don't poo-poo any of that stuff at all. But the bottom line is listening to your body, being your own physician, and seeing your physician as one of the tools in your toolbox. That's my approach. And inflammation can be caused by many different things.
Okay, so we have Patty who's here. Patty, do you want to ask your question? We always love hearing your
Yeah, I
your
could.
accents. There you go.
I've actually got to go because I've got a yoga class to go to. But I'll just ask this because it's kind of intriguing. Should we be trying to run? I mean, when I'm doing my walking on a tread, I'm getting to sort of 5.5 kilometers per hour as a kind of my fastest walk, and I can do that for several minutes, but then I'm crippled. But should we be trying to push it to 6 or 6.5 or actually running?
Absolutely.
Is running a better thing than walking?
Running will induce claudication faster than any kind of
Yes.
walk. And you can walk up a steep slope, that'll do it. But as soon as I start running, and I mean, now my next race is a half Ironman in May, and I'll spend the whole winter trying to get my run back up. And that is a matter of minimizing impact to as close to zero as I can get. Changing the way I move really helps. So if I go from a stride to a shuffle, I'm using different muscles and I can go further. So right now, my big goal, apart from cycling and swimming and all that stuff, is to try and find a way to optimize the way I move with PAD for running. Remember, my right popliteal artery is 100% blocked. I have no dorsal pedal pulse at all, but my O2 sats in my right toes is normal, over 96. And so, and my left leg is starting to do the same stuff. I would say the biggest problem I have now is training my soleus muscle, which has a slightly different blood supply. So I say run if you damn well can, absolutely. And I'm trying to find ways to do it. And I think changing the way you're moving as you run, shifting the load to different muscles, using optimal body movement, which means a very pronounced shoulder hip counter rotation to minimize impact as you come in on the side of your foot. And I'll be damned if I'll let PAD stop me running. If I could run marathons again, I would love it. I mean, I really would. I don't know if that answers your question, but hell yes.
I just hate running.
Oh, no.
Well, you don't have to run. You don't have to run to
Wait a
do it.
minute. Most people hate running because the first mile sucks. No matter how fit you are, the first mile sucks. But let me tell you something about PAD and running. With PAD, the first 3 to 5 miles suck. It's just the way it is. And so you get through
Look
that.
at Chris's face.
You get to 8, 9 miles, things start to actually work. The trick is to get there. Getting is the trick without hurting yourself. I don't know why anybody would hate running any more than they'd hate a dog. I don't get it. But that's
Yeah, Rebecca
everyone's different.
says every mile sucks. One more quick one for you, Dr. Seenan. Someone's asking about walking sticks. So walking sticks, how do you determine what the right, size is and if they're right for you to use walking sticks? She feels like it might help her with her gait as she's walking.
Yeah, and is that meaning kind of like the walking poles or walking sticks?
Walking poles.
Poles, yeah. I think that, well, I mean, first of all, they're great. I think they're really helpful and useful, and they can help you go further, make it a bit easier. So, in terms of like, how do you know the right height for them? I think that wherever, if you go to a good kind of climbing mountaineering shop, they will probably measure you up for them, but often as well they're adjustable. And so I think it might be a bit of a kind of trial and error. I think I don't know, Kevin, do you use walking or running poles at all?
I did in Switzerland for hiking a bit, and it seemed to me that if I got the wrong height, my shoulders would let me know really quick. So
Yeah, so you just
listen to your
adjust.
shoulders. So I think your shoulders will really tell you.
Yeah.
Yeah. Fantastic. Well, thank you so much, everyone, for joining us on this edition of the Collateral Nation. Hopefully, Dr. Seenan, if you have any fellows that could join us in future Wednesdays when we have our Collateral Nation, we always value your time and expertise of you and your entire team. You know, I think it provides great balance in terms of, you know, trying to answer questions and get the message out, because that's the majority of questions that we get every single day. It's really on how to exercise more effectively, and everyone wants it individualized to them. But everyone, we want you to sign up for our 30-day to a 5K. It's not too late. Go to PADwalkinggroup.org and go ahead and sign up. You'll download our app, you'll fill out our little survey, and you'll get started. You'll get the videos that Kevin's been talking about to learn how to do your yoga toes, your P.A.D 100, and then being able to apply those while you are walking to help you walk more effectively. So thanks everyone for joining us. Make sure you like this video, subscribe to our channel, and get notified every single time we have another edition of Collateral Nation.
Thanks, Kim.
Thanks all.